Good morning, everybody. We're here to begin, I think, a very important new chapter in a discussion about a problem that deserves more attention and more of a public dialogue than it's had before. And it's a dialogue that has to happen between some of the partners that we have here. I want to recognize some of them. We have, behind me, we have representatives of the medical community, represented by Dr. Papp from Metro Hospital. Also, Vince Carafi from our County Board of Health. We have Chief Clayton Harris from the Chiefs Association. Of course, Sheriff Bob Reed from the county, but we've also been partnering with the U.S. Attorney's Office. We have Luis Vasquez, who runs our reentry programs for the county. Also Bill Denahan, who's been a longtime leader in this area from the Adams Board, and I'm probably skipping some of the partners. That's part of the dialogue that we want to start here, but it's also more than that. There also has to be a dialogue and a conversation between family and between friends about this issue. I want to tell you how this started in the first place. About 3 weeks ago, Dr. Gilson, who also stands behind me from our medical examiner's office, came to me and said, Ed, you need to look at the statistics of what's happening in this county with the number of individuals who are dying from heroin overdoses. We're on track for just the first 6 months of 2012. We've had 80 human beings in this county have died of a heroin overdose. And we've got to be real clear about the fact that, first of all, the statistics are headed in the wrong direction. At this rate, we'll have 160 people die in this county from ODing on heroin. That it's been going up every year for the last 4 or 5 years. You're talking about a rate that's more than double what it was just a few years ago. So the trend couldn't be worse. And we also have to be very clear that this is not a problem that can be consigned or written off to just one particular group or one particular part of the county. This isn't something that happens to other people, or it's not an inner city problem. This is happening all over the county. It's happening in the city of Cleveland, but it's also happening in the suburbs. People that are affected by it are people that you know. They're going to be your friends and you're going to be your neighbors, and we need to try to elevate the dialogue on this as much as possible. I'm going to turn it over shortly to a couple of our partners in this, but I want to just mention a few things that we're seeking to do from here on out. First of all, the beginning of this Heroin Initiative is really a subset of a task force called the Opiates Task Force, which has been working on this issue for about a year. We have a few things that we want to do in the coming months. First of all, we're going to focus on intervention strategies that really focus on at-risk groups. Now, what are those at-risk groups? Well, they're people that, first of all, the drug use tends to trend to the younger generations. So we are looking at ways to engage younger people in this community about this very important issue. Also, people that have been in the justice system, people that have been in a rehab program but are now out of a rehab program. One of the problems with heroin usage is the users of heroin don't know the purity and the quality of what they're taking. So sometimes when people have stopped using the drug and then they go back to it, because the relapse rate for heroin usage is alarmingly high. Some of the statistics show that as much as 80% of people who have been addicted and have gone through treatment end up relapsing, and that's when many times the overdoses happen. So we're going to be looking at ways to have creative interventions for all of those at-risk groups. Another thing we're doing is we're taking through the medical examiner's office, we're going to start taking an approach we've used for child fatalities. When we have an unfortunate situation in this county where, let's say we have a child that's in custody through Department of Children and Family Services, when there's a fatality, we have an official process where we review that fatality. In other words, we look at how did it happen? What would the points of intervention be where maybe we could have had a different outcome, where that child's life could have been saved? We're going to start doing the same thing when there is an overdose on heroin. How did this happen? What were the points in the road or the fork in the road where somebody's life could have gone one direction if they'd had the appropriate intervention, but unfortunately it ended up being a fatality? So we're going to start doing that to try to learn what lessons we can glean from tragic circumstances. And related to that, we're also looking at what the rest of the country has done and what the rest of the state has done that has worked. What are the strategies that have worked? Because there are counties across the United States, even in Ohio, Cuyahoga County, for instance, has been a little bit more aggressive about this. And we want to look at what we've seen that has worked in this area. There's just a lot of misconceptions about how people get into heroin use in the first place. I mean, I can tell you from being a county prosecutor many years ago, the individuals that we saw using heroin, let's say in the 90s, were more of what would be the stereotype of a hardcore addict. What you have now is you have people migrating from the abuse of prescription drugs and then migrating to heroin. It's the prescription drug abuse problem has been really the gateway now to heroin usage. And we've got to get that message out there as much as possible. In the coming weeks, we're going to be setting up a website that's going to be hosted by the county that's going to try to be kind of a one-stop shop for people that are trying to get information about this problem, for parents, for school administrators, and for young people to try to get accurate information and then direct them to the resources, some of whom are represented here behind me. At this point, I want to recognize, if I could, Dr. Gilson. He's the medical examiner for Cuyahoga County. Again, I want to give him the credit within county government for kind of sounding the alarm on this, but he's going to get a little bit more into the specifics of what he's seeing in his office. Doctor?
Thank you, sir. As the executive mentioned, this is a problem that we've been tracking for a little while. We became aware of the initial rise in this towards the end of last year. In your packet of information, what you have is basically the numbers that we've seen over the last 5 years. In 2007, we had 40 deaths that were related to heroin. As of last year, we had 107, so there was a substantial rise. As the executive mentioned already, just through the first 6 months of this year, we've had close to 80 deaths related to heroin. If we keep on this trajectory, that represents a 300% increase in the number of deaths since 2007. It was very alarming to see this. In fact, this may be the first year that we write the word heroin on more death certificates than we write the word homicide. I think that the numbers are telling, but the other thing that really we need to bear in mind is what's borne out on these maps. The map to the far right is the data that we saw in 2007. There's a smattering of deaths that are occurring in different parts of the county, but no more in terms of the numbers that we see than 2 to 3. This is a cumulative map, but what I hope it represents is we're seeing a number of deaths in a lot of different counties. Right now, to sort of summarize what's happened since 2007, we saw about a 75% increase in the city of Cleveland in the number of heroin fatalities from 2007 to 2011, and we saw almost double that number of increase in the suburban communities. This is not a problem that is at all limited to Cleveland. It's in every community, and like the executive said, these are our neighbors, these are people that we know. It's not the face of the traditional heroin addict that we might want to stereotype. What we've seen to put a face on these numbers are the biggest increases we're seeing are individuals in their 20s, and they tend to be young men. They frequently come about heroin not through picking heroin up itself, but because of their abuse of prescription painkillers, and then they transition to heroin, which is just an illegal painkiller. The other point that I would really like to stress before I turn back is the people that we're seeing are overrepresented with people who have spent some time away from the drug, and that's really an important public health message that we're going to try to convey is individuals who are coming out of penal institutions who've been incarcerated, individuals who've gone to treatment who have some time away from heroin, are really overrepresented in the number of people who we see dying of this problem. These folks lose their tolerance. They could tolerate a higher level of these drugs at one time. They get their time away from the drug, they lose that tolerance, but unfortunately they try to go back to the same dose that they left off at, and they can't tolerate it anymore. It's a tragedy we see too many times in my office, and I appreciate the executives taking the initiative to pay attention to this. This is a very sad statistic. If you can turn it back to you.
I want to follow up on something Dr. Gilson mentioned, and that is the way we're approaching this problem is we're not being taking a one-sided approach to what our strategy is. In other words, as big of a law enforcement problem as this is, we know that you're not going to be able to incarcerate this problem. That's not going to be the complete solution. Although I will say, and we certainly have law enforcement represented behind us today, we think that we can make some strides in the way that we enforce our drug laws and prosecute these cases. I mean, it's stunning, and Sheriff Reed could speak to about this after we get done with our formal presentation. But for instance, just our sheriff's office took 18 kilos of heroin off the streets just in 2011. Now, we don't have all the statistics for 2012, but again, this is an incredible spike. And if you're taking that much off the street, it means that, you know, you'd like to say you're getting it all off the street. You know that you're not. So we know that there's a lot more that's out there circulating. But this strategy is really an attempt to have an intersection between different segments. So that's why I'm not standing here just today with police officers and sheriffs. This is an intersection between those from the medical community, our medical examiner's office, law enforcement, reentry, and all of these folks working together, I think, is going to create for much more cohesive and balanced strategy. There are different parts of our society will touch the potential user at different points, and that's why it's important, we think, to have more of a balanced approach, which is obviously necessary, as you can see from the results on the map. It's touching every corner of the county, unfortunately. So with that in mind, I want to recognize one of our medical partners in this whole process, and that's Dr. Papp from Metro Hospital. Doctor?
Thank you. In the emergency department, we're also seeing an increase in heroin and opiate overdose. In 2007, some of our crude data shows that we saw approximately 68 overdoses and opiate-related complaints. As of 2011, that number almost doubled to 126. Again, some of this data is crude, and we estimate that we're probably missing quite a bit of the heroin and opiate-related complaints because many of the patients who come to our emergency department are not willing to share that they are addicted to opiates. They may be hesitant to come forward because they are concerned that their healthcare provider may not treat them the same. They may also be concerned about legal issues as well. With heroin and opiate abuse, not only are we concerned about death, but we are also concerned about some of the other facets of disease. And some of those include skin and soft tissue infections. We see a number of patients presenting in heroin withdrawal, developing dehydration, and we are also seeing some of the complications that can involve heart valves and spinal infections as well. So we are working toward developing issues in the emergency department to address opiate abuse, and we are working toward reviewing the patient's prescription Ohio Pharmacy Board report more frequently. We've developed a care plan in the emergency department to address specific indications for opiate prescribing guidelines, and these are also something that we have developed as a hospital-wide policy for prescribing guidelines in the hospital to make a more unified policy for our hospital.
Thank you. Wonderful. So just quick, couple quick thoughts, and then we can take a couple questions if you'd like. If this is a one-time press conference and that's the end of this, it will have been a failure. This has to be the beginning of a discussion and a dialogue. If this effort doesn't spur discussions between family members and between friends and between loved ones who are seeing signs of this, then we'll be a failure. I also want to mention that we do have a timeline of other activities that we're going to be doing, and we're going to continue to roll those out, including the launching of our website, which will happen soon, and then also the fact that we're doing, or the Opiates Task Force is having an event this Friday at Embassy Suites where they'll have over 100 participants that are partners and are interested participants in what we hope will be a really comprehensive community-wide strategy. Any questions anybody has for anybody here behind me?